Hello. We are going to talk to a patient about a video testimonial about her eyes and what an impact treating the right cause has helped in terms of her vision and overall functioning. So, a little history. This patient came to us a couple of years ago and just been monitoring her eyes for cataracts as well as a macular pucker. But when she was telling me that her vision comes and goes, is fluctuating, she's not comfortable in her contact lenses, which she loves to wear for swimming, and everything else didn't make sense in the puzzle of her blurry vision, then we started looking at her oil glands and her tear film, improved that with oral supplementation of fish oil, as well as we did a few IPLs, which are helping to regrow her oil glands and help her function. So we're going to talk to her. Hi.
Hi.
So what was bothering you when you first came in terms of your vision?
It was quite blurry, and I thought I was ready for cataract surgery, and I was actually kind of excited about that, to be able to really see clearly. I like to wear contact lenses. Sometimes my eyes get really dry, and I've been using eye drops, which is probably not the best thing, but I was referred here, and it's been a really good experience.
So let's talk about the specific therapies we've done. So we added the fish oil to your regimen, specifically the PRN brand, which has a dry eye formula. And you've noticed additional side benefits other than the dry eye improvement. Tell us about your systemic improvements that your family practice doctor noticed.
I tend to have a cholesterol issue, and taking the fish oil supplement, when I went to have my cholesterol tested, the good cholesterol numbers, my doctor said he had never seen numbers that were that high. Usually he sees them, I think, maybe around 30 or 40, and I think mine were somewhere around 70 or 80, so it has a very, very good benefit. I was very excited not to be on statins anymore.
So we were able to eliminate a medication.
Exactly.
A statin, which can certainly have other side effects like cramps and whatnot, and which sometimes, you do need a statin, and we will leave that to your primary care doctor, of course, but so the quality of the PRN brand fish oil is also really important. And then let's move on to the IPL. So when you saw your glands on the scan, and we talked about how improving the gland function could help the dry eye, you were like, let's do it.
I was excited, and looking at the pictures today, they have definitely improved. Many of the glands are longer. Some that I don't have cannot come back, but the ones that are shorter have gotten longer, or at least stronger. So that's really exciting, good news. And I'm happy.
And my goal is always, to try to get you to not think about your eyes. You don't think about your fingers or your arms or your wrists, right? Your eyes should just be a normal part of your body. And we're trying to get all of it to function like a normal part of your body. So I think we're getting closer and closer to that goal. How do you feel?
I feel really good. The fact that my eyes are not as dry as they used to be, especially when I wear contact lenses. I don't have to put drops in, so that's extremely helpful, and I'm happy not to have to do that.
That is awesome. And then the IPL itself, the procedure, did you have any pain with that, or?
No, there
any side effects?
No, there was no side effects. If there was anything, it might be kind of cosmetic, that this area right here seems to have tightened up a little bit.
Great.
So
great side benefit.
Yeah, that's that's good.
It is used for cosmetic procedures as well. We did the dry eye protocol settings on you, but that's great. Well, thank you so much for taking the time out to speak with us today, and I'm glad you're continuing on your improvement journey to get your eyes feeling better and seeing better overall.
And I have recommended this procedure to a friend of mine who has really dry eyes, so I hope she's gonna take my advice and make an appointment.
Thank you so much.
You're welcome.
All right, see you guys later.